Give it to me. Back up. Why are you taking all that wood? Here. 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 Come on, Duke. Here. Be nice. Here. Thanks so much for the comment. I really appreciate that. Here, Duke. Come on, bud. Give me that. Give me that. Okay, you can sit there and relax. Hey, Karen, how are you? Yeah, I'm gonna take it away from you, Duke. Just temporary. You can play with it. Don't be eating that. It's not good. Duke. Hey. Duke. Don't chew that. You won't get your treat. Here, give it to me. Hey, come on. Don't be chewing that. It's not good for you. Okay, I'll leave it alone. I don't know why the camera goes blurry. Duke. Hey. Cotton candy, corner, love dogs, cheers. Don't be doing that. Don't chew that. It's not good for you. You know I'm gonna put these in the wood stove, Duke. Hey. We'll let him keep playing for a few minutes. I'm gonna take my hydrochloric acid. You can play with it, but don't swallow any of that. Okay, Duke? Be nice. Just don't swallow any. It's actually 5:47. It is quite early. Probably everybody's still out there having dinner. I hope you guys are doing good, staying nice and warm. Trying to get my wood stove going again here because we left it off. See if we can get it up and going. Because it's getting a little bit chilly right now. Jeanette, how are you? What's the best way to combat a sweet tooth? Increase your fat intake. Increase your fat intake. Eat more eggs. Eat more butter. I just had 13 eggs, so you gotta eat a lot of fat That's the only way you can actually feel satiated and don't actually crave any sweets. Give it to me, Duke. Yeah. I said don't swallow any. Leave it. Leave it. You're gonna hurt yourself. Leave it. Now. Don't do that. Leave it. I told you you can play with it, but you're chewing it. Leave it. Leave it. Now. Are you ever gonna get chickens out there next season? Let me see. Did you cut yourself? Let me see. Good. You don't chew on that stuff. Next season, actually, I am gonna start to get about 10-15 chickens to start with. I got my neighbor who's actually gonna build a nice section for them. So between my section and his section, and we'll probably do that because I do need some chicken, right, Duke? He's chewing the wood for my little fire, for my little wood stove. We got the wood stove going right now. Where is it? There we go. It's getting there, nice and hot. You want one? You want one? Come here. Come and sit. Come and sit right here. Sit right here. I'll give you one. Sit down. Sit down. Come here, Duke. Hey, you wanna sit there? Okay, you can stay there. Looking good, stud muffin. I don't want it to get too hot. Guys, whoever sent me some messages is being blocked, so definitely fix it up. Duke, hey, listen, yeah, come here. Sit down, sit. If I give you one, you're not gonna, look what you did, you're gonna, listen, you want one? You're gonna be nice? Don't swallow any of it. Let me get you a new one. Here, this one is better. Take this one. Okay, go sit there on the carpet. Go sit on the carpet. Or on the bed, whichever is easiest. Wouldn't eating that many eggs and butter raise my cholesterol? What digestive enzymes do you use? Eggs don't really raise cholesterol. I just had 13 eggs. The butter will raise it a bit, but it's nothing really to worry about because it's not really gonna conflict. As long as your cholesterol is not being oxidized, it should be good. I have 5, Jeanette. I only using about an acre from it right now. The rest of it still needs a lot of tree cutting and a whole bunch of stuff. So this way I can get maybe a couple cows next year. Love your new wood stove. Cheers. Thank you. Wouldn't eating that many eggs. No. Hello, Maurice. Question. What can I do to reduce my afternoon 3 p.m. fatigue? I've noticed this for about 2 months. Take some creatine. Your body is struggling for some mitochondria energy. Creatine D-ribose would be excellent to actually get started on. Thank you. I appreciate you. No worries, Jacob. Anytime. Yeah. So eggs are not gonna. Don't think about eggs raising up your cholesterol. So every egg has roughly about 2 grams of fat. 2 grams times 10. That's 20 grams of fat, which is nothing. Keep in mind your cholesterol, dietary cholesterol has nothing to do with blood cholesterol at all. Hello, Maurice. Tried the magnesium. It actually didn't taste bad. I started with 5 drops. 5 drops is good. It's a good start, which is nice. It's nice and bright here. I like to sit by the wood stove, but I don't have much lights there. Duke, why don't you chew this one? Why don't you chew this one? Here, this one. This one is easier. Give me that one. Give me that one. Come on. Don't do that. Don't do that. Hey, give me that one for a sec. I gave it to you. Give it back. Let's go. Take this one instead. Yeah, take this one. Here. That one is better. How many drops should you do? For the magnesium, start with about 10 drops, which is about 50 milligrams. Work your way up to about 20 drops, which is about 100 milligrams for about 5-10 days. And after that, increase to about 200 milligrams. That's how much I take per dose. 200 milligrams would be ideal. Every 4 hours would be good. What's the best advice to lower belly fat? I need to drop 10 pounds. Well, you can do berberine, but make sure you cycle it 45 days on, 5 days off. Insulin, you want to increase your insulin sensitivity. And the best way to do that is by taking all your carbohydrates and moving it to last meal of the day. That would be like your best scenario to actually start to cut down, and you become more insulin sensitive. And this way you can actually cut down on the body fat, let's say, and start to burn your own body fat. Duke is a problem child. He's just going after the wood like crazy right now. Look at him. He's so happy because I got all the wood inside because it's been really wet outside. Trying to dry them out, and he keeps taking them. What, you want that one? You took like 6 already, Duke. What's wrong with you? Okay, don't hurt yourself. Look at him. He wants to play with the pieces. I didn't feed him chicken today. He actually had meat, and because there's no bones, he wants something to chew after he finishes food. There he is. You guys can see him. That's his favorite little carpet. I gotta get him a new one. It's like ripped apart. Berberine, what's the dosage? 500 milligrams to 1,000 milligrams. No more than that. But keep in mind, you have to cycle it or else it's going to destroy certain gut bacteria because it has an antifungal effect. Sanchez, yeah, no worries, anytime. On top of everything else. Hey, Ziggy, how are you? I should be free early next week and we can actually discuss your protocol because I got it done and just haven't had a chance to send it over to you. And maybe we can discuss it early next week, if that would be great, like Monday or Tuesday. What type of nitrate supplement is the best to use? I do have it on my website, actually, for the one that I've been using for the past 10 years. And I just took my 2 capsules. Duke, leave the wood alone, bud. What country are you in? I'm in Canada right now. Duke, what are you sniffing? You okay? Come here. Come here. The hawthorn is interesting. I open the capsule and mix it with water. You can actually make it into tea, a hawthorn tea. So definitely, if you don't want to swallow it, like take the 500 milligrams, you can actually just boil it in water and make it into tea. You still get your polyphenols and you get the vitex that the berries contain. Back up. Okay, listen. Don't want to hurt yourself, right? You have to be nice. If you're gonna chew the wood, you have to spit it out. Don't swallow it. You got it? Here you go. Don't swallow any. Chew it and spit it out, please. Okay. Go sit on your carpet. Or give it back to me. You don't want it? You want me to hold it? Okay, listen. I'll give it back to you. Okay. But go sit on your carpet and enjoy it there. But don't swallow any pieces, or else I have to take it away from you. Okay. Duke, we're not going outside right now. No, it's too dark. And I know there's a lot of deers out there. It's been going nuts on them. The doctor says my triglyceride level is too high. It's 193. What can I do to bring it down? So keep in mind, what increases triglyceride is the amount of carbohydrates we tend to consume. So one thing is you do have to shift your carbohydrates to last meal of the day, Karen. And I probably suggest you taking some niacin to actually help with the support a bit. Back up. Duke, back up, please. Sit down. Okay, listen. I'm gonna give you this piece, but don't swallow any. Here. You want it? Any treatment for edema of feet and legs? Yes, magnesium ionic chloride. Your kidneys are not functioning correctly, causing probably issues. Just don't swallow any, okay, Duke, or else I'll take it away from you. Nettle tea for kidneys, 100%, yes. The magnesium chloride is good for the kidneys too. Magnesium has about 400 different functions. It's going to be good for the kidneys, organs, liver, pancreas, brain, cardiovascular, but you need to hit about 6 milligrams per deciliter. So therefore you can cover your whole system. Hey, don't swallow it. That's why magnesium is essential for our bodies, especially with that many potential effects. Same with vitamin D as well. Duke, hey, spit it out. Don't swallow it, please. I take ionic, omega, magnesium, and potassium. Ionic, mega, magnesium is a liquid. And how much potassium? Is it potassium citrate? Need to get him rawhide instead. Rawhide is not good for them. I do get them bones, but we're currently out. I usually get them rib bones. But the butcher that I usually get it from, he's totally out right now. He usually doesn't, this is the first time he ever chewed the sticks. He usually gets chicken bones as well too. And he didn't have any today. We actually changed it up. We kind of gave him meat today and pumpkin, and he still wants something to chew to clean his teeth. And I should have probably got him at least one piece of chicken to actually clean up his teeth at least. Once I got stung in Canada at the river. Duke, hey, are you swallowing the stuff? Let me see. Let me see. Don't swallow it, okay? You're making a mess. It's okay. We can burn it after. Just don't swallow any, please. I don't know why the screen goes blurry when it's like gets dark. There you go. It's back to normal again. So Karen, don't forget to get yourself some niacin. Would be ideal, and I can show you the niacin that I was talking about. Switch the camera. So you can get something like this as well too, so you can control your triglyceride a little bit better while you're actually fixing the diet a bit. So you can get something like this as well, the niacin. 500 milligrams is not bad. It's gonna cause a flush effect, which is fine. That's part of the process. Just gotta keep an eye on Duke, just make sure he's not swallowing any. Spit it out, Duke. Don't swallow it. Spit it out. You understand very well. Don't swallow it. I need to get the table up in the center so I can have it set. I don't have to keep holding the camera. Man, the creatine, D-ribose. Are you currently taking them? The creatine and the D-ribose? Have you started yet? Duke, why don't you take your nap? Pure energy, it is pure energy because they are the backbone of your mitochondria. And you know, anytime you're feeling down or anytime you feel like you're fatigued and stuff, pretty much you need it. Keep in mind, everything in the body requires energy. You know, whether you're eating, sleeping, exercising, anything you do, you need energy. And without that energy, the body cannot function. Usually, technically, we're supposed to get it from food, but we barely get any. We need to eat so much to kind of get the amount as a supplement. Every day for 2 months. That's awesome. How much D-ribose are you taking? I hope you're not exceeding too much. Duke, hey, Duke, don't swallow any. Okay. You want a bone? He stops. You rather have a bone? It's better than a piece of wood. You wanna go get a piece of chicken? But they're all frozen together. Do I need potassium with B12 supplement? There's no need. You should be getting enough potassium from your food. Half a teaspoon D-ribose with 1 teaspoon of creatine. Half a teaspoon of how much? What is that? About 2.5 grams, correct? As long as you're not taking 2.5 grams, maximum 5 grams per dose is ideal. So I think half a teaspoon is about 2.5 grams. I'm gonna actually, when I head back to the city, probably in December, I'm gonna make an order of 10 kilograms of D-ribose. So if you guys wanna split it, I know I did say that before, but I couldn't get it here where I'm at. But when I get back to the city, I'm gonna order 10 kilograms directly from the manufacturer. So if you guys wanna split, I have about 5 people. I need like 5 more people. If each one of you guys wanna buy a kilogram, I can probably ship it to you guys. Because probably a kilogram could last probably, well, it can probably last almost a year. Depends how often you guys use it, 5 grams or 10 grams a day. I usually do, on certain days I do 10, and certain days I do about 2.5, 5 grams, no more than that. And 8, okay, yeah. Guys, send me a message, let me know. When I head back to the city in December, I'll probably place the order. And this way we can get it split up and can send you some grams of what? D-ribose. D-ribose. Okay, my name is Greg, actually. Yeah, send me a message, send me a direct DM. I'll put your name on the list, Greg, with the email address and stuff. And what I'll do is when I place the order, I'll let you know. And, you know, whatever the cost is, we'll all split it. I'll get a few more people to actually go into it, and we'll go from there. You probably just have to pay shipping to your location. Doctor said I have hyperthyroid. Hyperparathyroid. One parathyroid is enlarged and they want to do a surgery. It depends how enlarged it is, and it depends how long it's been, but you can actually control it with acetyl L-carnitine, but you need about 3,000 milligrams daily. Yep, we have had a few calls. You have helped me greatly. Sounds good. Yeah, no worries. Duke is going to the kitchen and picking up on things. Where do you get this empty carton of eggs? It's empty. There's nothing in it. You already ate them all. We go through a dozen every day. Well, actually, just for dinner, I had 13 eggs. He had 3 eggs with the meat. Hi, Maurice. I just came in. What is it good for? D-ribose is your mitochondria energy. It boosts up your mitochondria. So think of it as it's a sugar molecule that's actually highly given to a lot of patients that actually have heart disease because we lack of energy, we lack of mitochondria support, and the only way we can actually reboost our mitochondria. It's not. I don't remember you, Greg. It's just well, in here you have the N8, the Great. I just sometimes I know you guys don't put your real names on there, but keep in mind I get. You know how many Gregs I have? I have 8 Gregs that I actually deal with. So maybe if you give me a last name, I'll know right away. But I know you probably don't want to give me a last name there. Duke, stop getting stuff from the kitchen or else I'll kick you outside. Yeah, you're making a mess. Are you gonna clean it up? I know I mostly argue politics with my screen name. So that's why you don't use your real name. So it's good for people with congestive heart failure. 100% it is, yes. 100% it is. That's why some cardiologists who are actually like, they deal with natural stuff, they always encourage people to consume a lot of mushrooms because that's where you get most of your D-ribose from. In Idaho Falls. Oh, there you go. I know which one you are, Greg. Okay, put me on the list. Yeah, send me a direct DM, please, just as a reminder, because I don't have my pen with me right now. I'm not sitting by the computer. So you guys send me a direct DM with your full name. And once I get some, I know it's not going to be anytime soon till I go back to the city. It's going to be at least the first week of December. I'll probably place the order. I'll get it in about 10 days. And after that, you know, probably you guys can get some by late December, early January. Because when I order from the manufacturer, I get it directly from the manufacturer. The patent, the bioenergy is the manufacturer, so I get it directly from them. What are you ordering? D-ribose. Back up. Back up. Now. Good. Listen. You want some D-ribose too? So you can be jumping. So yeah, I think every pound of mushrooms, you get roughly about a gram of D-ribose. Well, okay, puts. Now. DM on TikTok, yeah, please. Just just when I open up the computer, I can copy and paste the information into an Excel. Back up. Back up. There. Here, give it to me. Give it to me. Yes. Okay. Ow, ow, ow. You're chewing my finger. Go. All you want to do is play. Didn't play today because it rained too much. Okay, back up. Take a step back. No. No. Okay. Listen. Ready? Set. Good. Okay, give it to me. Give it to me. Good boy. Back up. Go far. Go far. Go far. Okay, here. Give it to me. Give it to me. Give it to me so I can throw it again. Here. Here. Stop teasing me. Here. You want to play? Here. Okay, I got it. Come here. Here, look, I have it. Okay, okay, okay. Drop it. You drop. Okay, I got it. 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 Come on, camera. Gets blurred. There you go. Okay, here, give it to me. Give it to me. You want me to throw it? Here, ready? Back up. Marek, how are you? Hey, I got your message and I couldn't respond because I am live. But you asked me something about a blood pressure. Duke, if you swallow any, just rip it apart and that's it. Don't be swallowing anything. I'm happy to have almost completely eliminated sugar. That's awesome. Good to hear. Continue at it. I am in ER. What's going on, Marek? How high is the blood pressure? (170/105). What did you do in the past 4 hours? Obviously something that you consumed or something you're taking that it triggers it. So you were training. What did you take at the training? Anything other than what we discussed last time? The gym should not really conflict with your blood pressure. Overall stressful day. Are you taking the L-theanine, nitric oxide, nitrate supplement, anything? I miss coffee, but still no coffee, alcohol, sugar. I gotta stop coffee again because I've been drinking 4 cups a day. It's crazy. Lack of sleep. That's not good. How come you're not sleep? You're becoming like me. I haven't slept for 4 days because sometimes I wake up in the middle of the night, wood stove is off and it's freezing cold. All combined together, so it's fine. It's probably hitting you. Come here. That's not good. So you probably depleted your magnesium completely or overusing your magnesium that your blood pressure has gone up. So you got too much contraction going on, not enough relaxation. So something must have is draining the magnesium too fast, probably because all the combination of everything. I'm gonna get you, Duke. You made a mess, and after I just vacuumed, bud. Yeah, I'm gonna get you. Get ready. I'm gonna set the phone and grab you and put you. Okay, that's it. That's it. That's it. You give it to me like a good boy. Leave it. Drop it. Now. Good. It's good that you listen really well. All this time in training you is actually paying off, which is good. Camera went blurred again. Let's put this stuff away. So he doesn't grab it anymore. We'll book a visit tomorrow. Yeah, let me know, Mark. Hopefully things are going okay. Are they giving you any magnesium sulfate to actually drop the blood pressure, or are they giving you any? Usually they give you sometimes 9 grams of salt or sodium IV. You know, it's funny. You work so hard with do. I worked with him so hard in the first 2 years was very frustrating. Almost he's gonna be probably 3 years very soon, but it's a lot of work, a lot of work, a lot of control. How to control extra hunger when it gets cold? Increase. You have to increase your fat intake. If you don't increase your fat intake, you're actually your hunger is gonna actually continue fluctuating and it's gonna actually increase. So without actually increasing the saturated fats, you're not gonna be satiated. So that's it's a big issue with a lot of individuals. If don't cut down the fat, try to actually include as much fat as possible. Even if you're eating a steak and you've noticed you're not eating enough fat with it, you know, increase, put some eggs with it, put some eggs, put some cheeses. It doesn't have to be butter like certain individuals do. Give it some nice flavor so you can actually feel satiated. But like for example, you know, when I eat the meat, when I had 1 pound of meat today, I had 4 eggs with it and about 4 ounces or so of cheese. So that's where I get my fat from. So you're actually feeling satiated. If you don't do that, you're just gonna feel hungry pretty much within the hour. That's my dog's age, Riley, 3 years old in January. Yeah, Duke will be 3 years old end of January, February 1st. He was born, and it's almost like at midnight. Hey, Baruch, Israel, how are ya? Gotta vacuum all this wood again from Duke. But yeah, that's the problem. Especially keep in mind, Ziggy, fat. You know, consuming the fat as well is gonna actually keep you a lot warmer in the winter time. And if you actually eat any type of fat, and when it's cold and you go out for a 15-minute walk, the cold exposure, you're gonna turn that fat into brown fat. It's gonna become more insulation and actually causing, like, say, inflammation or any other issues. So there's a lot of things has to be kind of adjusted so you can actually feel fulfilled. They have to explain to liberals why Trump is a good president. Trump is a good president. There's a lot of things will be changing, especially when it comes down to the health and nutrition part as well too. We're gonna start to see a lot of new things gonna be available for the public that has been hidden for many years. Wait, what? Say that again about the walk. So what happened is cold exposure walk after a meal will actually increase your brown fat for insulation instead of white fat. So it actually gives you better insulation for the body. So that's why a lot of people that actually consume, let's say, carnivore diet, they don't get as cold as people that actually consume, you know, more carbohydrates because we carry more brown fat. Yes, RFK in change of health, 100%, 100%. We're gonna see a lot of amazing changes when you get rid of Trudeau. Well, I hope Trump will actually fire Trudeau and get rid of him because we need him out. We're actually we're struggling here in Canada. Like seriously, I went today to town to buy a carton of eggs. Like the prices keep increasing. You know, for 12 eggs, I pay like today $8.50 a carton just for one carton. And imagine I go through about 10 cartons a week, me and Duke, just on eggs. So everything is becoming like too expensive, way too expensive. How can I get rid of excess adrenaline? I feel like it's causing me anxiety. Take some L-theanine. I like Pierre. Pierre is good. You need chickens. I need chickens next year. That's the plan. Next season, when I come back here in April, I talked to my neighbors, so we're gonna actually have a chicken coop. I pay $5 for farm eggs, organic. Wow, yeah, and ours are not even organic, and we pay 8.50. It's insane how expensive things are right now. It's insane. Best supplement for burning fat fast. You got berberine, you got alpha lipoic acid, you got shifting your carbohydrates to last meal of the day. Hi Maurice, when is the best time to take MK7, last meal of the day? Because that's when your calcium is most active and that's when you can actually regulate and control your calcium levels in the body. At night, last meal, the fattiest meal, would be the best time to take your MK7. We're talking roughly about, let's say, 500 micrograms. It's getting cold outside actually today. It's supposed to start snowing. Okay, there is. Duke is back. Come on in, bud. Come on in, Duke. Come on in, Duke. Come on. Don't touch the wood. Leave it. Leave it. Leave it. Leave it. Get out of here. Go. You already made a mess and cleaned it up. Go. Go, place. Go. What is your thoughts on vasovagal syncope? I gotta look into that. Vasovagal syncope. Can tinnitus be a sign of narrowing arteries? Yeah, and it's mostly oxalates. Mostly oxalate issues that happens from tinnitus. So if you can get rid of the oxalates in your body, usually it fixes the issue. And one of the best thing to do is magnesium and nitrate supplement. 6:25 p.m. in Los Angeles. Yeah, 6:25 here as well too. It's pitch dark right now. That's it. Winter when it gets dark like around 4 p.m. Which just kind of sucks. The day is so short. I hate the beginning of winter, November all the way to like February. I don't like it. Duke, leave it alone, please. How about a cramping for my mom legs and even neck? Take some magnesium and glycinate. Duke, I took you for a walk today for nothing, eh? I took you for a walk for nothing, right? Go, place. I've tried L-theanine, it didn't really help. I've heard that vitamin D and magnesium deficiency also cause anxiety. Is that true? Yeah, if your magnesium is below 80 nanograms per deciliter, it does that automatically. And methylated B and L-theanine is just gonna help you calm down till you actually fix the root cause. L-theanine is not gonna fix the root cause. L-theanine is there to support the brain and support the anxiety and the stress. But you can take tyrosine as well too to speed up the process and enhance it. But don't just take 200 milligrams of L-theanine. Sometimes you need about 400 or 600 or even 800 milligrams. Every person's body is different. Go. Up. Stop making a mess. Go. You're getting frustrated because you didn't play much today because of the rain. Can I take ionic magnesium and magnesium glycinate together? Yeah, you could. You can take magnesium ionic during the daytime. You can take magnesium glycinate at night. Home remedies, lung issues. For lungs, you can do NAC, vitamin A. But NAC, you gotta take about 2,400 milligrams every 4 hours. 5 days on, 3 days off. I'm not sure about that. I gotta look it up, Arch. I have the info with me right now to kind of tell you the exact if there's a main permanent damage or not. Yes, I'll help you, Ali. If you book a time, we can kind of go through everything and actually give you a full protocol to follow as well. Will NAC help walking pneumonia? Yes. You have to take it with vitamin A, such as retinol as well too. My vitamin D was 250. How much should I take now? 250, I think that's the North American or Canadian form. 250 is good. So to kind of maintain, I would actually do 1000 IU per 25 pound of body weight as a maintenance level. Why do they say to at least less animal for oxalate removal isn't from plants? Oxalate is highly found in plants, not animal. And sometimes when you eat animal products, you're gonna get a little bit more pain because you're actually going through what's called oxalate dumping. And trust me, when you go through oxalate dumping, it's freaking painful. But that doesn't happen till at least like 3 years down the road. My vitamin level. Yeah, you're at 250 nanomolars per liter, which is about 80 nanograms per deciliter. So you take about 1000 IU per 25 pound of body weight. So based on your weight. I missed the talk about the ribose. Can it affect the blood pressure? It supports cardiovascular support, so therefore it gives you the energy that it requires. Nothing to do with blood pressure. Blood pressure is more of a magnesium issue, and I did a lot of ebooks on the blood pressure, how to actually fix it as well too. Trying to kick Duke outside for a bit. You staying inside, Duke? Come on. So think of D-ribose as an energy molecule. Think of D-ribose when afternoon crash happens and you don't want to take caffeine, you take D-ribose, because what happens is your mitochondria struggles, your mitochondria drops. So think of D-ribose and creatine are like the backbone of your mitochondria. As simple as that. What are your thoughts on taurine for general health? I'm 48 with no medical issues. Thank you. Hey, Pete, how are you? Thanks so much for the support as always. I take taurine daily. I take about 9,000 milligrams of taurine daily. Keep in mind, taurine has antiplatelet effect. It does actually allow more magnesium to saturate the cells correctly. Our heart and eyes and brain have the highest levels of taurine. I even give Duke taurine. And keep in mind, taurine is used in a lot of energy drinks for protection, to actually protect the heart from seizing up or cramping, for example. So taurine is very, very highly used and has lots of benefits. I did lots of videos on TikTok. I should actually transfer them over to YouTube talking about taurine, probably almost about 10 different videos. But it is one of my favorite supplements. And every dose I take, make sure you take it on an empty stomach. Don't take it with any meals or any other amino acids, because the other amino acids will actually conflict with the absorption and it won't do what it's supposed to do fully. So even if you drink a lot of coffee, or even if you do a lot of energy drinks, or even if you actually overtrain or overexercise, always good to have the taurine, because it's going to preserve all the electrolytes for your heart as well too. Even if you have no medical issues, overall it is good to actually maintain in the body. Yeah, so everything, guys, that we're doing the live videos and everything is all being recorded on YouTube, so you guys can always go back and watch it. Any psoriasis recommendation, that's all coming from your gut. All coming from your gut. Taurine helps me sleep. Yeah, it's used for a lot of things, and there is some recent studies on it for anti-aging even. Diverticulitis, you can actually start using digestive enzymes. There he goes. Guys, if you get a chance to tap the screen, we can get a lot more people to join us as well. I know I'm not staying very long time, but I should start to come more often, but we've been really busy with the weather. I've been spending most of my time splitting wood. You're like an international doctor. It is a good workout. It works your abs like crazy, seriously. Splitting wood actually works your abs like crazy. Like tomorrow I have to do some more. Today I only did about a couple. Tomorrow I gotta do some more because we end up getting some heavy rain. Is it snowing there? It is snowing on the mountain, not yet where I'm at. It rained and snowed the same day, so it all kind of melted, but in the mountains we already got slight snow. I don't want to take medicine for my cholesterol and blood pressure for my life. All that stuff is fixable. Cholesterol is not really the issue. Cholesterol becomes an issue when you have blood pressure. So that's where you have to kind of be careful. We can actually adjust that. We can fix it with nutrition, or you can kind of check out some of the ebooks I wrote, how to lower both successfully. Should I take 200 milligrams ubiquinol at once, or is it better to be taken spread out? Technically, an average person, any type of with cardiovascular issue, they have to be consuming about 300 milligrams of ubiquinol daily. Separate dose would be ideal. So let's say you do 100 and 200 in the evening would be probably the best thing to do for ubiquinol. Unless you eat like beef heart, then you get plenty of coenzyme Q10. Where can I get the ebook? If you click on my picture in the top left corner, it's gonna take you to my main page. On the main page, there's a website. Then you can actually access the ebooks from there. Water retention is the pits. Yeah. Water retention is all to do with your kidneys. Is 3 grams a day enough, or should I go up 6 to 9 grams? Usually for anybody who's starting, I always kind of suggest doing 3 grams 3 times a day for the first 90 days. So this way you can saturate your body with proper taurine. Then after cut it down to 1 gram 3 times a day. I've taken as high as 100 grams a day of taurine. There's no side effect. There's no issues. There's no digestion causes or anything like that. Sometimes on days I don't feel good, or on days I even drink a little bit too much caffeine, for example, I take sometimes 12 grams, sometimes 20 grams a day. What does it mean when chloride high in the blood test? That's like your sodium levels. So start with like say 1000 milligrams every, let's say 3 hours or 4 hours. See how you feel. If you don't feel anything, I would actually increase the levels. I started automatically at 3000 milligrams. And usually most companies, they come with a scoop of 3000 milligrams minimum. Keep in mind, by the time it goes through your digestive system and everything, you're probably only gonna absorb very small amount. You are so amazing, generous, coming on here and doing that. Cheers, Lee. Thank you. I really appreciate that. Is it fixable for cholesterol and blood pressure? I want a natural way to. Yeah, 100% is fixable. 100% is fixable. So this is a taurine I take, Pete. I gotta take my dose right now as well. But so this is the one I got, and every scoop, I keep it out here because I take it so many times. So there's 3,000 milligrams. Oops, there's 3,000 milligrams. Then I drink my magnesium. And that's it. It works really good. Arch, taurine saved my life. What is the best brand? The brand I'm using, this is a Canadian brand because I buy it locally. Prior to that, I was using Now. They all kind of use almost very similar manufacturers. There's only 3 manufacturers that actually create this. So the one I'm using is Taurine, a Canadian brand by the company named Canpriv, and usually they come in a 454 gram container. Opinion on creatine. I take creatine. I take creatine twice a day. As soon as I wake up, I take 3 grams for mitochondria support, and I take about 5 grams after training. And sometimes if I'm lacking energy or feeling tired, I take 5 grams when I with my sleep formula. So taurine, think of it as for antiplatelet, anti-aging. It's heavily found in the eyes, brain, and heart. Usually people that actually experience heart disease or heart attacks, they're actually deficient in taurine. Taurine will preserve all the electrolytes for your heart, so it never goes into spasm or never actually gives up. So that's why you end up seeing taurine is used heavily in a lot of energy drinks to kind of protect the heart. So it is good if you're the type of person that drinks caffeine like crazy. Would be ideal to actually use. If you are a heavy smoker, I would actually add NAC, N-acetyl-L-cysteine, 2,400 milligrams at least 3 times a day on an empty stomach. I did a YouTube video on benfotiamine. Benfotiamine is like the fat-soluble form of vitamin B1. It is kind of more synthetic, but for nerves, for heart, for irregular heartbeat, vitamin B1 or benfotiamine does help quite a bit. It is good, and I did one of the video that you can actually mix it with niacin. I take vitamin B1, 500 milligrams 3 times daily. I gotta go check on Duke, see where he's at, cause where's my flashlight? Where is he? Duke! Duke! There he comes. I use modafinil and taurine. Okay, that's interesting. How's it feeling like? I haven't tried that. I haven't tried the modafinil. I can't really get it here for some reason. But I wouldn't mind giving it a shot to see what it's like. Taurine for arrhythmia. Taurine is the main amino acid for arrhythmia, yes, with magnesium. That's how you can actually fix your irregular heartbeat or arrhythmia, because actually it fulfill your arteries, well, your heart with proper magnesium levels. Ever Ever hear of neurogum, nootropic gum, caffeine, L-theanine, B6, B12, focus energy? So it's the same thing as taking, I haven't heard of it, but it's the same thing as taking L-theanine. I take L-theanine and B6, 50 milligrams and 200 to 600 milligrams of L-theanine for brain support. So as a nootropic, the only thing that is actually working is the L-theanine and the B6 more than anything. After defibrillation treatment, my relative dies not feel. After defibrillation treatment, my relative dies not feel good. Sorry to hear that. Yeah, there's always the case of having issues. It feels like perfection. Thinking of adding creatine. Let me know how that goes. Sorry to hear that, Farah. Black tea, green tea, all that stuff, they have L-theanine, yes, but very, very small amount. You know, when we take 200 or 400 milligrams, almost equivalent to about 10 cups of green teas and stuff. My husband has been on 9 grams of taurine and oxy trace minerals for about 6 months. Was his MRBC is 5.2. Yeah, once his RBC hits 6 milligrams per deciliter, then you can actually reduce your taurine levels and you know, adjust your magnesium intake. So after defibrillation, you're not feeling good because you're pretty much you're probably deficient in so many minerals across. His AFib is much better. Perfect. Yeah, once magnesium is starting to get saturated, AFib will actually balance. Usually we've seen it take sometimes up to a year and a half, but 5.2 is a good level, so it's getting very, very close to it. I'm glad that everything is going okay. It will take sometimes, most patients will take them about a year to fix it. How do I increase my nitric oxide and magnesium levels? You take nitrate supplement and you have to take magnesium supplement. Do we take the magnesium chloride and taurine together? Yes, you should. Maurice, are you seeing my post? I have not, unless it's been blocked. What was your post or what was your question, please? Which is better for heart, EPA or DHA? Well, technically they say EPA, but the problem is with EPA, most of the time they come rancid because they're very delicate. So taking DHA will convert to EPA based on how much your body requires. So I take DHA direct. I don't take EPA anymore. Diverticulitis, you can take digestive enzymes and hydrochloric acid. Should I worry if the carbon dioxide is low? Not really, no. It's based on your oxygen level. I don't know if they tested your oxygen level or not. Oh, Duke is back. Why is my screen freezing up again? There we go. Wonder if I have to put more wood. How is your dog? You have a great dog. Yeah, he's sitting outside right now. He was here making a mess, Jeremy. I'll get him inside here in a bit. I see, is magnesium bisglycinate good for high blood pressure? It is okay, but it does not saturate your cells with magnesium. Can you say what I would take again? Sorry, digestive enzymes before every meal, roughly about 3 capsules, and you take hydrochloric acid after every meal. This thing is like driving me crazy. There we go. Tooth problem pain. Well, you gotta mineralize your teeth. You gotta look after your teeth. You have to actually use coconut, charcoal, xylitol. There's so many things you have to look after for your teeth to actually prevent any pain or any issues. Have you ever ate salmon liver or the raw? I do, yes. Especially when I catch them fresh. But I haven't had that for 2 years because since I got Duke, I haven't been going fishing. But next year, I'm planning to actually, because I got the fence to a little bit much bigger this year. So this way I can leave Duke by himself. I'm gonna go fishing every day for 2 hours. Every day. And I'm gonna catch some salmon and we're gonna have some raw or caviar for some people would know it as. I just figured it out. I have wasting syndrome due to cancer, so my body is not absorbing, and I have besides nitrates, what supplement can be used as vasodilators? Well, the most potent one is nitrate. Other than that, you have hawthorn, you have pomegranate, you have pine bark, you have garlic, you have cacao, you have a lot of other options, but the amount of you have grapeseed extract, but the amount of vasodilation is very minuscule, very minuscule. And that's why there's these testing strips you can actually test. There's arugula. So the top two, you have the nitrate, which is it comes from beets of 25% extracted. There is a patent design, or they come from arugula 10% as well as a patent design. Everything else is very minuscule, very minuscule. And keep in mind, there's certain things will cause inducible nitric oxide, not endothelial nitric oxide. So some will produce iNOS instead of eNOS. So we are looking for eNOS production more than iNOS or nNOS. There's like almost 3 different kinds. I've done a video on all of them. There's iNOS, nNOS, eNOS, and there's mitochondria nitric oxide as well too. Working and listening to your show. Cheers to that. Thank you. So I'm a huge fan of nitrate. I've been taking it for 10 years. I don't think I'll ever stop. Sometimes I take 1,000 milligrams a day. Sometimes I take 500. Sometimes I take 1,500 milligrams. So it depends how I feel. In the presence of vasodilation of the arteries, a person should never have a stroke or a heart attack. And same time, it does increases your EPCs to actually heal your arteries as well too. I have them all on the website, Pam. If you go to my website, you can actually see all the supplements I talk about and I mention, because I get a lot of questions about them. I just put them on the website, especially the nitrate, because you do need the practitioner code for it. Grain of salt. There's a lot of bullshit out there and a lot of influencers, and people say take a grain of salt. All it does is just help your body hydrate properly. But one freaking grain is not gonna do you much. You need at least 1/4 teaspoon to get the equivalent. So that's why magnesium is so powerful. If you take the magnesium by Aussie Trace Minerals, the one I take, you get 200 milligrams. That 200 milligrams is equivalent to 10 1/4 teaspoons. So a grain of salt is unheard of, and it doesn't really do any good for your body. Maurice, when I tried to get to your website and to book an app, it's not letting me. I should. When you go to my website and click either the 1 hour or the 30 minutes, it should actually take you there, unless something is blocking you. Where you're located, but it should work internationally. What is the best natural supplement for cholesterol? Is red yeast rice the best choice? There's red yeast rice, there's bergamot, there's berberine, there's resveratrol, there's niacin. There's some different options. Duke, Don't bark down this way. Hey, no. Stay down on this side. Hey, stay on this side, bud. Stay on this side here. How to heal gallstone? Like gallbladder stone, you have to do like a flush. Go get yourself a couple bags of apples and eat apples for 3 days. For kids with ADHD, what would you recommend for them to focus? L-theanine. L-theanine would be your best choice, or you can use tyrosine. Is ionic magnesium with chloride in liquid? It is liquid. It is natural form. It's not man-made. And that's how it should be. And actually, because it does come with all the trace minerals, it will actually absorb in your body correctly. Duke's probably waking up everybody, all the kids and all the neighbors. I know they're far, but still. Which brand of magnesium? I have the magnesium on my website. It is by Aussie Trace Minerals. Actually, it's imported from Australia, and it is distributed in the USA. So this is a company. So it does have all the balanced electrolytes in it, the trace minerals, and magnesium. That's the one that you need. Why is taurine is important? Taurine is very important as actually allow magnesium to enter the cells correctly. Without magnesium, without taurine, your body will never actually absorb magnesium. And taurine will actually does have a lot of benefits, especially anybody with heart issues. Duke. Duke, enough on that side, please. Enough. It's okay, there's nothing there. They're gone. There's no more deers. My 18 years old has PCOS, loss of appetite and nausea, not hungry till afternoon, minimal carbs. Any tips? Yeah, stop feeding them carbs. Can you suggest something for the weight and muscle loss? What do you mean weight and muscle loss? Like to put on weight and muscle? Hey! Enough! Is it okay to take ionic magnesium straight? Yeah, you should take it straight, but still magnesium, when you take the ionic chloride, it is good to actually have taurine with it or vitamin B6 for better absorption, especially if your intestine is not actually as efficient as they are or they should. Yes, correct, Var. Glad you added a gut reset program to your website. Yeah, I just changed a few things on the website, so this way at least because I've been actually Ziggy, I've been trying to kind of I took a lot of the stuff that I've been actually doing and kind of turned it all into a protocols right now, and I think it's been better that way. And the protocol is gonna always be like a 90-day protocol, and it's just specific steps from day 1 to week 1 to every 4 weeks, and there's a specific program you follow with specific intake of supplementation and other things. And I've been kind of working at it to actually make it very efficient. Hi Maurice, me Jude, haven't heard from you in a while. Hey Jude, how are you? Sorry, I have been behind lots, and it's funny because I do get some patients. They'll send me an email. They say, "Hey Maurice, you haven't responded to me in like 3 days or 4 days or a week." Guys, like sometimes I get really busy, and it's hard to actually respond to everybody on a daily basis. So sometimes you guys have to be patient with me. Keep in mind, my profession is very stressful, very stressful. So keep in mind, I deal with a lot of patients with heart disease, and I have to be there for them whenever they book a time and for emergency calls. And at the same time, I can't really respond to everybody's email address. I've been good. I haven't been that bad, Ziggy. 4 to 6 weeks is a long time. Sometimes, seriously, it does get that busy that it's tough to actually respond to everybody. And same time, sometimes I try to do it as fast as possible, but sometimes it's very, very tough. Especially, I do get a lot of emails sometimes where, certain individuals will send me like a whole page of information. And keep in mind, like I cannot just read the whole page and just give an answer. I have to actually sit and think about it and put all the information together. So it does kind of take a long time for me to respond. Thank you, Ziggy, for that. I'm trying, especially when I have Duke. Like Duke, he steals about 2 hours away from me every day, and he has to. He has the right to keep him healthy and kind of take him for walks and stuff. So 2 hours a day, it's like gone for him completely. I have a thing called wasting syndrome, losing muscle and weight, no appetite. Please help. I'll have to look into that and probably to kind of give you like a better info on it to see if it's probably it's an autoimmune disease issue. Then you'll have to go on what is called the elimination diet, and we might have to add leucine and HMB to prevent your body from actually going in such a high catabolic effect. There's always going to be Jeanette, there's always going to be new medicine and new ideas and new things, but a lot of this synthetic stuff, keep in mind, they conflict with our body's hormones, they conflict with our body's system, that you might maybe feel good, lose weight temporary. When you're off of it, you're back to square one. So I rather, something done naturally than to be like synthetically. Which way is he? Oh, I know why he's barking. There's somebody there. Probably walking, or a car light or something. It's okay, Duke. I can see them from here. It's okay. I have a sensor that actually picks it up right away. It's fine. They're okay. Yeah, I can see the lights. Don't worry. He sees light at the end there, so sometimes he doesn't like it. Thoughts on vegan diet? No meat, no eggs? Why? You want to become frail? You want to actually kill yourself? What's wrong? Eating vegan? I have nothing against it if that's what you want to go for. But the outcome, it's a short benefit. But a long-term outcome, you're going to actually destroy yourself and you're going to become deficient and across the board with a lot of things. It might not take 6 months or a year or 2 years. Maybe it might take a couple years, but you will actually get there. I've become frail and feel like I'm looking older. Well, a lot of density nutrients that's required is not available anymore, specifically for your mitochondria. And that's why it actually ages the person much faster. Is there a lot of wild there? Bears? Yeah, there's bears, there's coyotes. So that's why I always have to kind of keep an eye on Duke when he goes out. Yesterday we had 6 deers come to the gate and he was going nuts. He was trying to jump the gate. So I have to kind of maintain, especially at night when he goes out around this time. I'm like sitting by the door with a flashlight. The only thing that kind of worries me is mostly the coyotes more than anything. Do you believe meat ages you? I don't think meat ages you. I don't think meat ages you. And you know what? And then it's funny. It's a lot of things people put comments out there that meat ages you, or if you eat vegetables you feel this, or you do that. Eat what pleases you, guys. Eat what pleases you. And what ages every person is based on their culture, based on their ethnic group, based on what disease they carry, what issues they have. But all comes down to 2 things: your magnesium levels, your vitamin D, and your mitochondria. That's what actually help you stay in good shape. How many meals do you eat in a day? Do you ever show your meals? Yeah, like today I do show my meals lots. Like this morning I had 1 pound of meat and with about 4 ounces of aged cheese, Gouda. And my second meal, I only eat 2 meals. My second meal was 13 eggs and about 6 ounces of cheese. And I had a whole onion. I eat onions because it does help with testosterone. Um, can you take multivitamins if you are on blood thinners? Yes, you could, but I think multivitamins are a waste of money. The plant community says meat is very acidic, and an acidic state ages your cells basically. Well, it's funny they're saying that because our gut has the highest levels of acid. So no matter what you consume, everything has to go through the harsh environment of your gut to actually be processed. So when they say highly acidic, I just laugh at them because it's nonsense what they're saying. How can I heal from psoriasis? It's exactly what you're consuming. So something you're consuming that is actually conflicting into your gut. And 99% of the time, it's the food contains too much hormones in it. Too much hormonal food, sometimes found in eggs and dairy. Once you actually eliminate that, usually psoriasis will actually ease off and will disappear. Are you carnivore? I've been on a carnivore diet for 10 years. Is it okay to take ionic magnesium straight? Is it okay to use quercetin without cycling it? Yes. Yes, you could. 100%. 100%. Because you don't take probably a high dose, no more than about 250 milligrams of quercetin. Um, yeah, so it's been 10 years. Have not stopped. I don't think I'll ever go back to normal. I think that's normal eating for me, and I enjoy it. Especially the eggs. I look forward to 10 eggs a day, 13 eggs a day. I like the eggs actually. What do you think about extended fasting? Is amazing. I'm gonna go back. I didn't do any this summer. Usually I do like a prolonged fasting, 72 hours and 96 hours. I haven't done that for almost a couple of months. But if you want to hit autophagy, try to kind of look for 72 hours or more. Best diet for someone who is struggling to lose weight. It's not. Don't look at it, Bruce. Don't look at it as a diet. Look at it as a lifestyle. Because if you're gonna just look at it as a diet, you might do it temporary, lose weight, feel great, and you might fall off and go back to your regular eating habits. So it has to be a lifestyle decision, Bruce. So one of the best thing, I kind of tell everybody in the beginning, if you're eating 2 meals a day, make sure your first meal is strictly protein and fat, and maybe your last meal could have some carbohydrates. It is better to have your carbohydrates at night because you're more insulin sensitive at night, and you'll actually utilize the carbs way better in the evening than during the daytime. Do you think fruitarians are crazy? It's not whether, like I said, Scott, it's not whether they're crazy being vegan or fruitarian or not. Everybody has their own way of eating. If they feel their optimal level, let them enjoy it. I have nothing against that. In my point of view, I think every person should actually pick and choose what they think is best for them. I cannot make that decision for you. But if you actually come to me and you have a specific disease, I will tell you why your body has a disease and what you need to do about it and what lifestyle you should actually adapt. But I think if a person is living in a place where they have exotic fruits, damn, I'll be eating exotic fruits every single day for weeks just so I can actually indulge and enjoy it. But will I live off of it for good? Probably not. So it's something you have to actually make your own decision on that and see what actually benefits your body as whole. Don't just make sure you're just looking for specific things. What are your thoughts on red light therapy for increased mitochondria? I use Juve full body panel for that and other things. I use Juve myself. I have it in the city. I'm gonna start using it again. It is good for mitochondria support, but it is good for testosterone, especially if you shoot it on your testosterone male parts. 6 minutes every other day, it has shown to actually increase testosterone, and I've done the testing on it. I use it. I use the infrared. I even use it lots for my eyes, lots for my face, for collagen production, but I left it in the city because I didn't have the enough power off the grid to actually run it. But now since I got the power working, I'm gonna bring it with me and I'll be using it. So I have 3 different kinds. I have a full body one, I have a small face one that I was given as a gift as well too, and I have one for top of your head to actually stimulate your for the brain cognition. Now, if you actually put on your brain for too long, it does give you a headache for 3 days, but your cognition, your cognitive function just skyrockets. It's just pretty incredible. Thank you, Melly. I really appreciate that. Mike Tyson or Jake Paul. Hey, they're both amazing. Let's wish the best person to win. Especially as a woman, I think fruitarian messes up hormones big time. Oh, it does. It does. 100%. Everything has to be in proportion. So will I be fine just eating meat without eggs if I have psoriasis? Oh yeah, 100%. Especially if you can get yourself, Bruce, some grass-fed maybe. Meat would be ideal. If you're not able to get grass-fed, grass-finished, just maybe trim the fat away. Stick with more lean. But if you're able to get grass-fed, grass-finished, then definitely consume the fat with it. But do that on almost like an elimination type of diet, where you have one main protein course, and try to kind of stick to a single ingredient, not too much processing. And for the Juve one, you gotta make sure it is hitting your chest, your heart as well too. It's very good for that. So yeah, I believe in it. I do full body 12 minutes, and I do 6 minutes for man part every other day. That's how I've always done it. And I usually do 6 minutes for the brain as well every other day. Oops, I'm missing a lot of messages. Doc, I have sinus cold and a business trip coming up in 2 days. What do you suggest? 2,400 milligrams of NaC every 3 hours, 5 days on, 2 days off. What do you do? I missed the part you were just talking about. Oh, with the infrared light? Is that the one? The red light therapy? Would recommend organizing meet for someone with high blood pressure? Yeah, 100%. I'll do like a full protocol if you want. Oh, it's nice and calm now. Duke's not barking. When I do 2 day fast, my blood vessels shrink. It scares me. There's nothing to be scared. When was it? 2 years ago, I followed a specific program. I would eat one meal and fast 3 days. 1 meal and fast 3 days. I did this for almost a year straight. But the problem is I did lose a lot of muscle mass doing that. So you gotta be careful. What do you suggest for panic attack? Tyrosine, L-theanine. There's a lot of things you can do, Melly. Duke is going nuts. He's having too much fun. It's funny, when he's happy, he does this. When he eats like a big meal. He had a big meal today. It's hard to afford beef where I live. If I just eat turkey and chicken, is that bad? They don't have the density nutrients as meat does. That's the problem. That's the problem with the chicken and the turkey. They don't contain proper full level of vitamins and minerals. And that's why I don't eat them. I would only eat turkey only if I can hunt it. Like turkey season. Chicken, I haven't touched chicken for years because I cannot find pasture-raised chicken, and they're too expensive. And I can eat the whole chicken and I'll still be hungry. So I'd rather have meat. So look for quality over quantity, Karen, if possible. Do you believe the body can heal cancer? 100%. What do you think cancer is? The cancer issue is already trying to heal your body, but us as doctors and all these, they mess with the human body and they poke the cancer cells and they actually break them apart and cause a major spread. I'm doing that now. Meal every 2 days, but I'm slightly overweight, so it's necessary. 100%. It'll probably help you. Don't do what I did when I actually was at my best place and I ended up losing a lot of muscle mass. So you just gotta be careful. My panic attack went away when taking methylated multivitamins and magnesium. Keep in mind, Bruce, that the methylated does happen only if you have the MTHFR mutation. That's why it worked for you. If Melly does not have the MTHFR, then the methylated vitamins won't work for her, or the magnesium. So she has to actually start with L-theanine until we find the root cause. If her root cause is a methylation issue, then the methylated vitamins will definitely work for her, no matter what. Thanks so much for putting that out there as well. It's taken 2 years. My triglyceride dropped by 100%. Cholesterol ratio almost in line. Thanks. Sounds good. That's awesome. Good to hear. Keep at it. Thank you for your advice tonight. No problem, Karen. And seriously, where are you at, Karen? Are you in Canada or the US? Because our Canadian prices here right now are freaking ridiculous for meat. So that's why I cannot buy mine from the butcher or a farmer, and I try to kind of get like a half a cow or a quarter of a cow to actually save money, or else it gets very, very pricey, especially these days. Yes, okay. Look, try to look for yak meat possibly, and it doesn't have to be, the expensive steaks and all that stuff. It could be ground beef. It could be like I buy a lot of sirloin, top sirloin, inside sirloin, a lot of this stuff, and it's actually much cheaper than buying steaks. I don't eat steaks. Like imagine I've been on a carnivore for 10 years. I probably would have like one steak once every 2 months because they're just freaking expensive. At the end of the day, meat is meat. Do a gene methylation test. Maybe there's no need to do a gene methylation test. You can actually find that out by doing just a normal blood test and get one of the figures tested called homocysteine. Once you get your homocysteine levels, we can tell right away whether you actually have a methylation issue or not without spending the hundreds of dollars and getting a methylation test. And I know a lot of people, sometimes they get ripped off from doing a methylation test, and you don't need to. I missed the good old Canada. I left in 2019. Canada was good. Canada was good. I think it'll get better once Trump fires Trudeau. Then I think it'll be good again. What are your thoughts on Trump winning election? Do you think he'll make any changes? I think he's going to make a lot of changes, especially because, JFK is working with him in regards to the health industry. I think we're going to see a major change in that. A prostate health, check your kidneys. The cushions in between backbone or squish. What can I help? Please take L-carnitine. Wow, that's awesome to know. Hello everyone. Hey Latra, how are you? Trump and RFK power team. Oh, 100%. I think they're gonna do a good job and a lot of changes. So definitely looking forward to it, because here in Canada we're getting killed right now with customs like crazy. Keep in mind, I get all my supplements from the USA, because in Canada we have very limited distribution centers here and we don't get that much good stuff. So a lot of my good stuff for nitrate supplements and others, I get all from the US. And now our customs has doubled. So I hope, Trump and they'll get that fixed under the control once we get rid of our prime minister here. I've got kidney reflux and flow is bad. You need to actually start taking some nitrate supplement, Dave. Or maybe book a time with me. We can talk about it. Depends how's your filtration level is. You're doing a great job, Doc. Thank you for helping all of us. Cheers, Bruce. Anytime. You don't know politics. I don't want to know politics. My wife has really bad constipation. So constipation happens sometimes from overeating dairy, and sometimes it could be that you're losing some enzymes and the food is actually being jammed in your small intestines, causing a lot of constipation. Hey, I'm looking forward to that, goes in. So constipation, you can get it fixed. You have to just take digestive enzymes. Do not take fiber. Anybody that tells you take fiber is clueless, have no clue what's going on, because the more fiber you take, the more issues it's gonna cause. And start taking some magnesium citrate. So you can actually increase the water into your intestines so you can flush out any excess fiber and issues that is causing the constipation. But everything relates back to the diet. What is healthy might not be so healthy for that person. I'm on gut cleanse at the moment. Filtration is better. I don't have gout or psoriasis anymore. That's awesome. Keep at it, Dave. That's a good job. Yeah, fiber will kill you. Fiber is a myth. Fiber is a freaking myth. Some magnesium hydroxide worked for me. Yeah, magnesium oxide usually is meant for constipation. The hydroxide, they use it because it penetrates much faster and it increases more water as well too. I have the nitrate supplement on my website, Dave. If you go to my website, it's the first item under my supplement section. Yet they sell fiber like crazy. Another item he'll put off the shelf. Oh, it's crazy how much fiber they push. And especially if you talk to like dietitians and nutritionists, all they do is just push fiber and psyllium seed husk and all that crap. They're all the same. Magnesium citrate, they're all the same. There's no difference in brands because they all use about one or two different manufacturers. They all come from overseas. I've started an ionic magnesium 2 weeks ago, but I'm still not sure how often should I take it during the day, or can it take it all at once? You cannot take it all at once. Your body won't absorb it. You have to take it. You need a steady supply of magnesium, so you have to kind of take it every 4 hours. My heart thumps real hard after meals, probably the carbs, yeah, or sodium. Yeah, it's your potassium to sodium is thrown off balance, and usually the simple carbs or the sugars does that. It throws the ratio off. But the only way you can fix it, it doesn't mean you take potassium and stuff. The only way you can fix it is you fix it with magnesium, because magnesium will level off your sodium, will level off your potassium, and will actually make sure the ratio is corrected. So without magnesium, you can actually be hurting yourself than doing yourself any good. And what you see is you see a lot of people increase their potassium, but you're not supposed to be doing that. When you recommend zinc to be taken with meal, evening, away from magnesium, and make sure you are going to be taking some copper when you take it. And best magnesium to take would be magnesium ionic chloride. You're looking jacked. You're working on chest and arms tonight? No, I did deadlifts today. Oh damn, I thought it was the stomach bloating and touching the diaphragm for the heartbeat. Diaphragm for the heartbeat. With AFib, is it okay to take magnesium? You're supposed to take magnesium. How else are you gonna fix your AFib? After eating, you're getting that. Okay, so that's the magnesium that you have to be consuming, Ziggy. Hi Maurice, do you know how to treat block bundle branch? It's a problem with the electricity of the heart. Yeah, we need to probably go in specifics in regards to that. And I can give you some information and protocol on it. How much niacin should I take a day for kidneys? Probably about 250, 500 milligrams to kind of see how your body reacts to it. I take it with coenzyme Q10. Yeah, it's fine, should be fine, as long as you're not taking it with other minerals. My mom, who has AFib, told me lack of magnesium is the root cause. It is the root cause, 100%. What should I look out for when taking it? The flush effect. It depends how extreme it is. My wife is having pains in the lower chest. If it's moving, what will you recommend in the lower chest? Like, you gotta give me a little bit better information. Is it upper left quadrant, bottom right quadrant? Because it could vary. It could be pancreas, could be many things. You should also do a list of blood tests that are worth getting on your website, like a full body. I'll add that. I can add that. I get that question lots actually. You know, what do you do for cholesterol? What do you do for hormones or thyroid? Or I should actually have a list of blood work to get. Kelly, have a nice evening. So you have upper left then, upper side, upper left. So it is between your pancreas and your liver then. So nothing to do with your heart. I gotta put a piece of wood. It's funny how much wood we go through a day to keep this heat going. Oh, shoot. Give me a sec, guys. I gotta put some wood in there. Holy shit, it's hot. There goes Duke. Where is Duke is quiet? He heard you calling his name. What is low enzymes? Your pancreas is low in enzymes. Is there mineral or vitamin to help absorb nutrients? Digestive enzymes to help break down the food so you can actually get all the nutrients you require. What's your opinion of vitamin B17 from apricot seeds? I use it. I take 3 a day. I've been doing that probably for like a year or two. Especially if I am living in a city, I do it lots. Go to sleep, Duke. Go. There is Duke. You guys were asking about him. He comes in, he thinks he's supposed to get a treat or something. There. Hey, place. Good boy. Go to sleep, bud. No more noise, please. What's your opinion? We've answered that. Oh wow, it's 7:26. I was supposed to leave at 7. I'm 26 minutes over. Is there a mineral or vitamin to help absorb nutrients? Just take digestive enzymes. That's the only way you can actually absorb more nutrients. Go to sleep, Duke. Kidney, what tea you think help? Nettle. Me too, 3 a day for apricot seeds. Yeah, 100%. You need them, especially, especially if you live in a city. I would say go for it, especially if you actually live close to or doing a lot of work with EMF, computers, a lot of the stuff. Definitely it is ideal to have. Yes, thanks for the early lives. East Coast appreciates it. Thank you, Ziggy. No problem. I'm gonna try to come in a little bit earlier, as much as I could, and this way, if I spend another hour in the evening, like after this, to kind of do some more work, I think it'll be good. Because what's happening right now, since winter hits and it's getting cold, guys. So I have my wood stove right now running. That's how I kind of keep this place warm. But every day in the middle of the night, I actually wake up about 2 o'clock in the morning and it's like freezing cold. So I have to wake up and refire the wood stove. For some reason, the wood kind of end up burning off because I don't know how to set it up yet. I'm kind of working my way through it. So for the past week, I've been waking up about 2 o'clock, then I wake up about 5, then I fall asleep again for another hour or two. So my time frame for my sleep has been fluctuating so much. Sometimes it's too freaking hot, sometimes it's too freaking cold. So I don't know how the hell I'm gonna set this wood stove perfectly so it doesn't really give too much heat or gets cold too quickly. I'm still learning. What days are you on, please? I usually come every single day, but I haven't. Right now I've been coming in every like fourth or fifth day just because I haven't been sleeping, guys. Seriously. I haven't been sleeping because of I'm having a hard time setting up the wood stove. I have AFib. I'm on Astro 26 milligrams, Jardians. You still recommend magnesium? I still recommend magnesium, and I need you to actually start to wean off some of these medication. I can help you with that. What should I tea for liver? For tea, you have milk thistle, you have dandelion, you have alpha. These would be like your top. Green tea is good. Hawthorn tea is good. There's a lot of things you can do. I like alpha lipoic acid. I like L-carnitine. I like more of the supplementation because they're designed directly for that specific issue. Thanks so much for the time you're putting to educate us. You're awesome. Thanks so much, Gozen. Thanks so much for the message. I really appreciate that. I'll send you an email. Sounds good. Thank you, guys. I'm gonna get going, guys. What's good protocol for kids with asthma and hay fever? I can write you a protocol if you like, Dave. Definitely go to my website, let me know, and I can do that for you. Um, because some of the protocols, guys, does take me a couple hours. I did an average. Every protocol that I get asked to be done, I've already had like 3 protocols been asked over the past couple days. Average protocol is taking me about 2 hours to 3 hours to actually put it together. Just to kind of give you guys an idea. So it's not something that I can just say, hey, you want a protocol for the kids with asthma and stuff, and I can just tell you, okay, here you go, take this. No, the protocol is gonna actually tell you for the next, let's say, 90 days, what day one should be like, day two, week one, week two, week three. It's like a program that you follow. So the protocols do take me a very long time to finalize. I wish there's a system you can plug it all in and it does it all for you, but there's no such thing because a lot of this stuff is all based on scientific literature and scientific facts and studies and stuff. If stuff I've been taking myself, I can give you an answer right away. If things I have not been taking myself, I'll definitely have to kind of be careful of the dosing that I give you because I never follow the dosing that it says in the bottle. I always kind of deal with mega doses, but mega doses based on age, based on issues, based on other medications, based on diet. So there's a lot of bases I have to actually check. So sometimes it's not as simple as, some people might think. It does take a lot of time. Sometimes that's why I always say, give me at least 2 days to finish a protocol or 3 days. Ozempic, like I said, a lot of synthetic stuff is gonna work temporary, but once you gonna get off that temporary effect, everything goes back to normal. So same thing as you taking statins for cholesterol. You might take statins, you will lower your cholesterol. The moment you get off the statins, your cholesterol is back to normal. So it's not really a fix. It's more to kind of suppress the symptom, but you're not really looking after the main root cause. So yes, if you are taking it for type 2 diabetes, yes, you're probably gonna fix your HbA1c level, you're gonna lose weight. Once you're actually off Ozempic, guess what? You're back to square one because all it's doing is just hiding symptoms, but not really going after the root cause. No matter what, the root cause has to be fixed correctly. Guys, I do have to get going. I'm down to like 6% on my phone, so it's gonna probably die soon. You guys take good care of yourself. I hope I can come back again tomorrow, if not, probably in the next day or so. But we'll continue our chat and we'll go from there. And if I do miss any questions, which as I've seen, I missed quite a bit, send me a direct DM. I'll try to respond. In the meantime, you guys have a nice evening and hopefully I'll get some sleep tonight. Thanks so much, Ziggy, Amira. I hope I'm saying you guys' names correctly. Believe you guys take care of yourself. You guys be good. Go Zen. Thanks so much. You have a nice Might as well too, and we'll touch base, guys. Cheers.